Ms. Quenneville joins us now to tell us more on Forum Daily. Ma'am, welcome.
Thank you.
So what are the main takeaways from this recent study, ma'am?
We have learned on the positive side that people are comfortable seeking out support if they feel they need it, which is always a good thing. On the flip side, however, is the concern that we may not have enough capacity in the system to be able to accommodate the figures that you described, which is the highest number of people that we've ever had reaching out during the pandemic. So we learned that. We also learned that there is an increased use of alcohol, which has been consistent through the pandemic. Increased use of cannabis, which has also been consistent. Those numbers are not dropping, which has, of course, not only mental health, but also physical health concerns attached to it. So overall, it's fair to say that we're at a point in time, 2 years into the pandemic, where I think we have good reason to be concerned about the mental health of Ontarians.
Some very concerning statistics there, ma'am. So from your research, what are the reasons behind this rise in accessing mental health support?
Well, I think in part, some of the reasons that folks are reaching out is they are finding themselves struggling with stress and anxiety and depression. Some are struggling with loneliness and trying to cope with what has been, we can all agree, 2 very difficult years. And that's overall, as I said, a really positive thing that people feel compelled that they can reach out and try to seek the support that they need. The key, of course, is ensuring that they get the right support and get the kind of support that will help them with the right tools to be able to carry on and improve their mental health.
And you earlier said that we are seeing some capacity issues in mental health support. So tell us a little bit more about the current state of mental health support in Ontario, ma'am.
Well, as we've heard, the hospital sector, understandably, is struggling with capacity because not only are they nurses and others becoming ill with COVID themselves, but also they have burnout, and they've really had to dig very deep through 2 years of working extremely hard under extremely difficult circumstances. The same really is true in many ways in our sector, in the community-based sector, where staff have burnout. They've been called on to work extremely hard and as well in difficult circumstances. So a lot of concern about having fewer staff to provide more service to people. So that is something that we have been keeping our eye on and continue to be worried about.
So what steps need to be taken to improve this sector, ma'am?
Well, one step would be to think about the kind of people that are attracted to work in community-based mental health and addiction services and ensuring that we are keeping the fantastic staff that we have. And in doing so, we would hope the government might reconsider Bill 124, which of course puts a cap on salaries. It's particularly onerous for us because we typically will lose staff to other sectors that are higher paying. So there is that impact, which we continue to be concerned about and raise with government. And overall, it's an understanding that the mental health sector needs its own mental health supports from time to time. And this would be one of those times. So Canada Life had a recent survey that suggested nurses have the highest rate of burnout, but mental health has the second highest. So, we're right up there, and our concern about ensuring that we have the very best staff available to support all Ontarians is something we've been promoting with government.
All right, ma'am, just about 45 seconds left here, but for our Ontario viewers watching this right now, what are some resources currently available for them to immediately use for their mental health?
Well, I would highly recommend Bounce Back, which is a fantastic program, cognitive behavioral therapy that you can access over the phone. The province of Ontario has funded structured psychotherapy, and this program is part of that. It's free to all Ontarians 15 years and older. You can access it through bouncebackontario.ca. So I would highly encourage that as an early program that people can get. As well, there are branches, CMHA branches across Ontario. You can access those. And Connex Ontario, which provides lists of all the providers that are accessible to any Ontarian looking for services in their community.
Ms. Quenneville, thank you again for your time today.
My pleasure.